you're a patient who's recently being diagnosed with systemic sclerosis or scleroderma, what will your rheumatologist, what investigations would your doctor recommend to you, and how will you be monitored? I'm sure if you've met your doctor, your rheumatologist would have explained how the disease, how the trajectory of the disease will be, how the natural history of the disease will be, what you need to look out for in the long term. So the first time you meet your doctor and they make a diagnosis, they check a score. They see how thick your skin is and in what areas. So this will be checked every time you meet your doctor to see how you're progressing with treatment. The other important thing with systemic sclerosis is something called an interstitial lung disease that a person can have. So when this diagnosis is made, your doctor will usually ask you to do a CT scan of the thorax. Then often if on clinical examination we find something, suppose some signs of having chest pain or high pressures in your heart, so we'll ask for an echocardiography. And some patients often report that they have something called GERD, that is a gastroesophageal reflux. So based on the symptom that you have, you will be prescribed a set of medications and you will be asked to follow up frequently. So every time we look periodically, we will look at your lung functions, we'll look at your cardiac functions, we'll look at your renal functions, and also how well your skin is doing. And beyond this, some patients tend to experience some gastrointestinal discomfort. Some patients tend to have abdominal pain. Sometimes some patients get diarrhea. Some patients have difficulty while passing the stools. They might experience some kind of incontinence and overall fatigue, loss of appetite, symptoms like that. As a patient, what are a few things that you can do when you've been diagnosed with systemic sclerosis? If you're someone who's experiencing a reflux after you eat your meal, suppose you feel the food is coming back to your mouth, what you can do? You can eat smaller meals, smaller quantity of meals at more frequent intervals. And before you sleep, make sure you have a good 2 to 3 hour gap between your last meal and your bedtime. If your GERD is quite severe, GERD meaning the reflux of the food into your mouth, if it's quite severe, you can try to elevate your head when you're sleeping to a good extent and try to avoid caffeine maybe. Coming to Reno is the color change that you will get when you wash your hands in cold water, or when it's really cold, when you sit in a room with a very cold air conditioning. So in these patients, it's very important that we keep the Reno under check, and also because we have to prevent something called the digital ulcers. So when the Reno is severe and when it's occurring again and again, the patients tend to develop ulcers at the tip of their fingers and toes, right? So for this, we tell the patients to keep their extremities warm. We give them a couple of medications which will help improve the perfusion. And these medications will be tailored every time you meet your doctor. We'll see how well you're responding to these medications, and there'll be dose modifications on the basis of your tolerance and on the basis of a routine tests that we do to see how your disease is progressing or if there are any adverse events to this. So try to wear gloves when it's really cold. Try to protect your extremities. Wear socks at home or whenever it gets cold. And it's very important that you follow up regularly. Any new medicine that you've given, suppose you experience an adverse effect, it is possible. Rather than just stopping the medication, always go back to your rheumatologist, because there are multiple options that we can use to treat you. And uncontrolled disease would lead to more complications. So it's very important that you go to your timely appointments and maintain a healthy lifestyle. With this, your fatigue will improve and you will have an overall good quality of life.